And this is my prediction. This is how I think it's going to go. And actually, CCMI has updated all of our protocols in our new course to reflect this information. So if you want to learn more about it, go to completeconcussions.com and click on our clinic certification program. And from there, you'll be able to take or fill out a form to be able to take our certification course, which covers all of this stuff and all the evidence behind it. Now, if you're looking for just the Coles Notes version of it, I'm going to give it to you right here. This is what I think is going to happen. This is the way I think that the international consensus statement is going to go in the next 2 years, is that return to learn or return to school is going to happen concurrently with return to play. And you're going to be able to be on different stages of each segment depending on how you're doing. The new threshold for passing from stage 1 to stage 2 to stage 3, for passing to the next stage, is no longer based on the absence of symptoms, but rather the absence of symptom exacerbation. What I mean by that is if you're sitting there doing light cognitive activity and you have a mild headache and a little bit of fogginess, and you go to a half day of school and you still maintain a little bit of a headache and a little bit of fogginess, but it doesn't get significantly worse, that's going to be considered okay. And in fact, it already is. And this came from research that was looking at people returning to cognitive activity and finding that the more rest and the more that we delayed return to academics, we actually start to have a worse outcome. The longer you take off school, the more you fall behind. Okay, the more you have social isolation, you're not with your friends, you're not socializing, you're not interacting, you are now withdrawn, you're falling behind in schoolwork, you're getting behind on assignments, you have exams coming up that you're not learning the material for, and everything just starts to pile up and pile up and pile up. This creates anxiety, and it makes it actually more difficult for people to recover. So the new theory on how this is all starting to evolve is that we're saying, well, if you're going to sit at home and do nothing and have a headache, you might as well try to go to school. And if you're still going to have a headache, but it's not getting any worse, well, it's likely not doing any appreciable damage. You're not overtaxing yourself if the headache is just kind of staying where it is, and so on and so on and so on. So the new threshold for symptom or for stage progression is no longer being asymptomatic. It's now, does the next stage exacerbate your symptoms? If it does, you drop back. If it doesn't, you can move forward. And does the next stage exacerbate your symptoms? And when you bring exercise into the fold, having the two run concurrently allows you to mix and match between the stages, so that on day 5, which is where we're starting this now, CCMI now on day 5 is putting people on the treadmill and starting to speed their recovery trajectory by giving them an exercise protocol. So the way that this is going, like I said, is these two stages, and this is, I think, what's going to happen in the next international consensus statement, is that the threshold for symptom progression or for stage progression is going to be a symptom exacerbation threshold, and also you're going to be able to run the two things concurrently. You're still going to have to be asymptomatic, obviously, to do medical clearance and return to contact, but I think you're going to be able to progress through the return to play even if you're still having symptoms, provided that the stages are not increasing or exacerbating your symptoms, right? I think it's good for an athlete to be able to go back and practice with their team, provided they're not having an increase in their symptoms and they're not doing contact. That's a good thing for them. It's good socialization, it's good exercise, it's good for blood flow, it's good for mood, and I think that that will help recovery. So like I said, we've already changed, we've already shifted this way. This is how we're now handling our acute concussions, is we're starting to mix and match and do all the things to optimize recovery. Diet, exercise, the management of symptoms throughout return to learn, proper accommodations to get them through that stages so that they're not falling behind and not starting to get anxious, and all these things. The name of the game is to optimize recovery. And that's the big changes that I think are happening with acute concussion management, which is a huge, huge difference from the rest and do nothing type of mentality that we've had historically with these injuries. So exciting stuff. Again, if you are sitting there being like, man, there's a lot that I need to learn on this, and you're a healthcare provider and you're managing concussions, or you want to manage concussions, go to Complete Concussion Management, go to CompleteConcussions.com, check out our clinic certification program, fill out the form, someone will talk to you, and we can kind of bring you up to speed on all this stuff. And like I said, you get ongoing updates on all of this stuff so that when new protocols emerge, you're the first to know, so that you're always providing the best care for your patient.